Okay, a very good evening here from Yerushalayim, from Shaarei Tzedek. My name is Uri Schwartz. I'm the head of our Resource Development Department, and it's really a privilege for me, for us to host this evening with Professor Jonathan Halevy, our former Director General, our current President. The truth is that Professor Halevy at the moment is overseas. He is in New York on a very short visit. I'm sure he will tell you about that. But we are delighted that we tonight can tell you a little about the COVID-19 vaccines. The other Zooms we have had have been like without any real hope, or without being able to see any ending. And now at least, even though the situation also in Israel is getting pretty bad, at least we can now see the light at the end of the tunnel. So without any further ado, I would like to transfer the words to Professor Halevy. I would, however, like to say that since we are so many people online, at the moment we are 230 and people are still joining us, there will be a chance to ask questions at the end of Professor Halevy's talk. And please, I would suggest that you put them in writing and we will then answer the questions from what it says there. It will be impossible that everybody will talk at the same time. So without any further ado, Professor Halevy, bevakasha.
Thank you very much, Uri. So good morning, good afternoon, and good evening to all of you, wherever you are. It's really a pleasure to see now close to 200 people who are joining us today. And it's really my pleasure to talk about the vaccine that is of interest to everyone. And I will start by naming the topics that I will try to cover, each one of them very briefly, about the vaccine, and then we'll open it for question. So we will talk about messenger RNA, what it is and the role that it plays in the Pfizer and Moderna vaccines. We'll mention other types of vaccines. I will relate to the speed in which this vaccine was developed and why we should not be afraid from it. I will talk about the spike protein. This is the protein in the virus that serves the virus to penetrate the cells, and how the immune system fights it after being elicited by the new vaccine. I will relate to fake news that we are all exposed to about the vaccine. I will try to allude to the length of effect of the vaccine and how much immunity the disease itself confers when one had already the disease. And I will definitely relate to Israel and how it came about that we are leaders in vaccinating our population, despite the fact that we are slowing down a little bit in the next couple of weeks. I will also relate to the fact, does the vaccine prevent the vaccinee from being contagious? The answer is we don't know, but I will expand a little bit about that. And of course, everybody is curious about getting the vaccine if one already had the disease. So I will try to cover all these aspects in the next 45 minutes or so. I hope that that will answer in an early way, answer some of the prospective questions. But if you still have questions afterwards, I'll be glad to answer. So what is messenger RNA that everybody is talking about today? So I think we all heard about DNA. DNA, the code of which was deciphered in 2000, so it's already 20 years, is a group of nucleic acids, like chemicals, that are responsible to produce proteins in the body. Proteins in the cell are the workhorses of the body. The proteins are responsible for all our metabolic functions, actually every physiological function. Between the DNA and the proteins that the DNA is responsible to produce, there are two mediators. One of them is the messenger RNA, and it's important for me to explain this basic physiology because one of the main concerns is, will the messenger RNA, mRNA, do something to the DNA and change our genetic code, our ability to bring children to the world, to become pregnant? The answer is no. So you should look at the mRNA, the messenger RNA, as one of the two mediators. The other mediator is a structure in the cytoplasm of the cell. Cytoplasm is the part of the cell that is outside the nucleus. It's called ribosome, and the messenger RNA engineers the ribosome to produce protein. Now, it was found very early on during this epidemic by the Chinese, not only the genomic constituents of the virus, but also the fact that what is dangerous about this virus is that it penetrates the cell with the help of one protein. You all heard about it, called the spike protein. The spike protein just connects to a certain receptor on the membrane of the cell. The receptor is called ACE2, angiotensin converting enzyme 2. This is not important for you unless you are in the profession, and that's how it attacks the cell. So what does the vaccine do? And I'm talking now about the messenger RNA vaccines, because these are the two early vaccines that were developed by Pfizer, by Moderna. They are the same technology, same minimal complications, and I will try to explain why the complications are really minimal. And the traditional way of putting together a vaccine by just attenuating a live virus or killing the virus or engineering another virus to carry a molecule that will stimulate our immune system to fight the virus. These are not part of the Pfizer and Moderna vaccine. The Israeli vaccine, for instance, is an engineered virus, adenovirus, that carries part of the genome of the COVID-19, and that's how it stimulates the immune system. It's a completely different technology. We will not discuss it today because what there is in the market today are Pfizer and Moderna. AstraZeneca got initial confirmations now, especially in Europe. It's also an engineered different virus, but I want really to relate to the messenger RNA because all the 287 people that listen to me now, some of you in couples, so it's probably over 300, already got or about to get one of these mRNA vaccines. So many of you, many of us are bothered by the fact that we read everywhere that traditionally it took 5 to 10 years to develop a vaccine. And here we have a vaccine with a new technology, first in human, unheard of, the mRNA technology, and it was developed within a year. Should we be concerned about it? My answer is definitely no. It's not in 1 year. The mRNA technology brought to the world by the two Turkish immigrants that immigrated to Germany many years ago in the early 70s is already under experimental efforts to produce vaccine out of for at least 2 decades, probably more than 2 decades. The fact that it took less than a year since the beginning of the epidemic to complete these efforts that were not completely fruitful so far until the beginning of 2020 is the fact that governments, and I have to commend especially the American government, but not only, and President Trump, influxed a lot of money, billions of dollars, in the shadow of this horrible epidemic. A lot of money was given, so money became no problem. Hundreds of laboratories and scientists around the world were recruited, a concerted effort was invested, and that's how we see ourselves 9 to 10 months after the beginning of this epidemic with a vaccine. So nobody should be worried from the fact that corners were cut. You all heard the FDA. It's true that when 3 months ago, or 3.5 months ago, Pfizer and Moderna published their phase 3, the results of their phase 3 trials one of them 30,000 people, the other 40,000 people, which was very convincing, 94.5% or 95% success in inducing immunogenicity against the virus is a major success. But you know, there is the stock market. We suspected Pfizer and Moderna, they would like their shares to come up very quickly, which really happened. But I rely on the FDA and the European authorities. The FDA scrutinized their experiments very, very thoroughly by people who are internationally recognized for their expertise on vaccinations. All of them are totally unbiased with no conflict of interest, and they confirmed it. What's more, since the emergency use authorization, the EUA given by the FDA, and when you ask yourself, why did it have to be an emergency? So anything that is being done in the shadow of such epidemic is called EUA. It's not much different than usual. It was very thoroughly scrutinized, and when you read the data, you can really be convinced. And what's more, since this EUA, the emergency use authorization, was given by the FDA, I think a couple of months ago, we already have around the world close to 6 million, this is the last publication, 6 million vaccinees. So while these vaccinees, only few weeks elapsed since they got it, and maybe we should be concerned for longer term complications, and in a minute I will explain why we should not be. If you take the 70,000 participants in the phase 3 experiments by Pfizer and by Moderna, they are already 4 to 6 months after the vaccinations, and we didn't hear about any serious side effects. I will relate later to the cases of allergy, to the case in Israel of a very old patient who had resuscitation, cardiac resuscitation, 2 weeks before he got the vaccine, and he expired an hour after he got the vaccine. It was also heavily investigated. There's nothing to do with the vaccine. So, you know, after this introduction, I really want you to have faith in the authenticity and even the honesty of the publications, not the fake news, about the efficacy and safety of the vaccine. And I believe that everyone should get the vaccine, because this is the only way to mitigate this epidemic. I look at your faces, there are a few youngsters, and I don't want to insult anyone who doesn't look a young chap. I myself belong to the very risky risk group of patients, but I really want to appeal to those of you who have some background diseases. I'll talk about allergies in a minute, and they are taking many medications. You should not worry, and you should take the vaccine. The only side effects described so far, and as I said, we are talking about 70,000 people who are already close to 6 months after getting it, and close to 6 million people who are between 4 and 2 weeks after getting the first shot. And the only side effects were local side effects at the site, sometimes some fatigue in the 48 to 72 hours, very rare, by the way, but when we all get, I'm also between the two injections, when we all get the second, there's some more side effects than the first shot. So maybe there will be some more fatigue, maybe low-grade fever, no significant complications. And in a minute, we'll discuss fake news, but before that, I would like to talk about those who are still hesitating to get the vaccine, and they say to themselves, I'm 25, I'm 30 years old. If I get COVID-19, I'll probably be mildly sick, so I will join the herd immunity by this, and I should not get the vaccine, I should not take the risk. I want to say to these people that although I'm talking quite confidently about the vaccine, its efficacy, its safety, there is so much that we don't know about the virus. We at Shaarei Tzedek are in the midst of a third wave that is much worse than the first wave. Although in the first wave at the peak, we had 125 patients, but many of them were mild cases because this was before the time that the sick funds, the medical insurance in Israel, could treat mild patients at home. I'll tell you how we deal with it in Israel when we talk about how Israel did so well and does so well with the vaccine. But today we have in Shaarei Tzedek 95 people, most of them severe, 19 of them on respirators, 39 of them are defined as in severe situation. And yesterday we lost a 40-year-old patient, mother of 8, working in our delivery room, and she had no risk factors at all. No risk factors at all. Thin, slim, no diabetes, no hypertension, non-smoking, no background lung disease. So here and there, this virus that misleads all of us picks as a victim someone that according to our severity score should not be there. And that's why in the name of these losses, and also because we have a societal commitment to reach herd immunity as fast as possible, I think that everybody should be vaccinated. I hope the logistic problems and the supply problems will be solved everywhere like they were always solved, not almost solved, not completely in Israel. I have no doubt that with the tempo, with the pace of production, by Pfizer and Moderna, of vaccines on a daily basis, until mid-2021, there will be vaccines for everybody. And of course, the high-risk group, those who are above 60, 65, with relevant background diseases or without relevant background diseases. And younger people with relevant background diseases should be the first together with the medical personnel. And I believe that if we want to continue leaving schools open, and I am all for it, also the teachers should be high priority in getting vaccinations. As to the fake news, so I'll tell you, in Shaarei Tzedek, we have 1,600 nurses. Many of them did not finish planning their families. You know, many of them are characterized by large families, by many kids. They still want to become pregnant, and they heard that this vaccine, the Moderna and Pfizer vaccine, may affect fertility of females in males. This is fake news. mRNA, messenger RNA, cannot change the DNA. It's a product of the DNA. It does not work vice versa. It cannot change our genome. It could not have any teratogenic effect on the offspring, and it's safe to become pregnant after getting the vaccine. It's even safe to give the vaccine during pregnancy based on a scientific logic, but not based on experimental data, because there were not enough pregnant women participating in the phase 3 trials that were held by Pfizer and Moderna. So I would not be hasty to give it to a pregnant woman, although this is, according to the literature, considered safe, but I would definitely give it to someone in the fertility age who plans to become pregnant, even if she plans to become pregnant very soon after getting the vaccine. This is part of the fake news. There is no impact on the DNA. I would like to relate, I already got a question about autoimmune diseases. So it's true that vaccinations in the past elicited autoimmune diseases. This was ascribed to the adjuvant molecules, the usual vaccines, the live attenuated vaccines, and the killed virus vaccines, which are the traditional vaccines, in order to accelerate their impact on the immune system. They were fortified by different molecules called by the collective name adjuvants. And the autoimmune diseases that were quite rare, but we knew it, they did break out, they were elicited by these adjuvants. The messenger RNA vaccine are a non-adjuvated vaccine. It does not need an accelerator. The messenger RNA does the work. So again, the scientific logic and the data accumulated so far does not attest to any possibility of a new breakout of autoimmune disease as the result of the vaccine. So this is also part of the fake news. How long does the vaccine confer immunity? So first of all, let's discuss how long does the disease itself confer immunity. You all read that with many of the people who suffered from COVID-19, 3 or 4 months later, the titer, the level of antibodies goes down to below the level that be considered that confers immunity. If you go by this logic, if we are now at about 75 million people in the world that had COVID-19, let's say that 20 million out of them, it's an assumption, already had it more than 3 to 4 months ago. And if you measure antibodies in their blood, many of them will have no antibodies or very low level of antibodies. By this logic, we should have seen today hundreds of thousands of cases of reinfection, of second infection with COVID-19. Till yesterday, in the medical literature, there were anecdotal reports about a little bit over 100, 130 people who suffered reinfection. What does it say? What does it mean? It means that probably the disease confers more than the immunity, the usual immunity expressed by immunoglobulins, by antibodies. Probably it elicits the cells called T lymphocytes to develop a memory that will confer the immunity for much longer than these few months. And this was measured in the laboratory, and that's the only logic that can explain why don't we see a second epidemic of reinfections among the tens of millions of people who already sustained COVID-19. So I will be calm about that too. And the question arises, of course, how long should we be calm? Mutations, new mutations, should we need to get a vaccine every year? So the answer is maybe, we don't know. We have to continue following, but I think everybody who had during this epidemic had the disease should be calm that his or her chance to be reinfected are very close to nil. Will there develop a mutation that will not be sensitive to this vaccine? And as far as we know, and we already, even at Shari Tzedek, we already analyzed the genome of the British mutation. We found that about 1/7 of the new cases in Israel are from the British mutation. And we know that this mutation will be sensitive to the vaccine. And it's also easy scientifically to explain it, because what is a mutation? Look, the spike protein, these weapons of the virus, the spike protein is composed of more than 100, couple of hundreds of amino acids. These are the components of every protein, of every peptide. The mutations that were discovered so far are few amino acids away. Few amino acids were changed. So again, the scientific logic says that if we have a protein here composed of couple of hundred of amino acids and 3 or 4 of them are changed in the mutation, this will not change the sensitivity of the virus to the vaccine. So we should be calm about that too. Of course, the more the disease is more spread, the more vaccinations we give, that's the natural development in a virus. It will try to avoid the vaccine and develop a new mutation. So the worst scenario that I see is that it will be like the flu, where every year we have new mutations. Every year we need to develop a new vaccine. But there are good news regarding these new vaccines, because as opposed to the traditional vaccines with attenuated live viruses or killed viruses, where every year scientists have to try and predict which mutation of the flu will prevail next year in order to produce the vaccine. The mRNA technology, which is really genius. I believe that these two Turkish scientists should get the Nobel Prize this year or next year for the mRNA technology in vaccines, in vaccinations. According to this messenger RNA technology, within a couple of weeks, scientists can prepare a new vaccine that will be efficacious against any new mutation. It's engineered like this, it's easy to do it, much easier. Of course, they will have to produce it. So the scenario as far as the period of time that we are immune after sustaining the disease or after getting vaccinated, I think it was going to be at least a year, maybe every year we will need a new one. I am not sure that the virus will extinguish itself like previous coronavirus epidemics did, the MERS and the MARS of the previous decade, 2008, 2009. But if not, we will have a new vaccine every year. So all in all, when we talk about vaccinations, we should be very proud with our scientists. I think this is a year where we all have to salute to scientists. I'll talk about the medical stuff next, but these are scientists who spend their time in the laboratories and were able to come within 10, 11 months after the beginning of the epidemic with an efficacious, safe vaccine that we should all use. Now, of course, there is a matter of production, and I want to talk about Israel because everybody is wondering how come that Israel is a leader that was able to vaccinate 11 to 12% of its population within 3 weeks, at least the first shot. So I think it has to do with few issues. One, I believe that the officials in the Ministry of Health in Israel who are in charge of purchasing started their negotiations with Pfizer and Moderna and AstraZeneca, by the way, that was delayed. If you have question, I will relate to it, but I don't want to mention it now, not to waste time. But the negotiations with Pfizer and Moderna started very early, much earlier than most countries. This is one of the reasons. Second, as you all know, we have a very charismatic prime minister, and whether it is for political reasons, because we have our 4th elections in 2 years, in 3 months from now, whether the motive is political or the love of the people of Israel is the main motive, it's immaterial. Our prime minister is charismatic, very eloquent, and he finished these deals by contacting directly the CEOs of both companies, Pfizer and Moderna. I am not sure how many heads of states took the trouble to contact directly those who can make the decision how early to supply the vaccine. He did it few times. He takes full credit for the accomplishment. I don't care if he deserves the full credit or half the credit. The fact is that Israel got 2 million shots early in December, before the end of December. And we were able to give, I got the vaccine as part of the medical staff on December 20th, 2.5 weeks ago. I'll get the second shot, I hope this coming Sunday after going back to Israel. I forgot to tell you that I'm here talking to you from the US unexpectedly, and we in Shaarei Tzedek have Hakarat Hatov. We pay tribute to major donors. I was asked by major donors of us, Betty and Zvika Reisman of Los Angeles, to come and discuss a major gift, and I'm on my way back from Los Angeles to Israel, here in New York today, after yesterday getting a very significant, major, generous gift from the Reisman family, from Betty and Zvi Reisman of Los Angeles. And I want to use this opportunity where we have 300 attendees to thank them from the bottom of my heart, and that explains why I talk to you from New York. Let's go on with Israel achievements. So Israel also has a very unique healthcare system. And I believe that the relative low number of victims of this epidemic has to do with the two main parts of the Israeli healthcare system. One is the hospital part. So I'm not going to say that Shaarei Tzedek or Hadassah or Sheba or Bellinson are better than Cedar Sinai in Los Angeles or Mount Sinai in New York or Columbia in New York or any other major academic hospital in the States. But somehow to deal with the severe cases, and it's true, we lost 3,300 people to this epidemic, but when you analyze the victims, many of them were not only very elderly. You know, in Judaism, Chayei Sha'ah is like Chayei Netzach. Every hour of life is very precious, but many of them were in nurseries with very, very severe background diseases, and they got the COVID-19. I assume that about 50% of the victims of COVID-19 in Israel, actually the COVID-19 was in the background. And the main reason for their death was not COVID-19. If you accept this fact, the number of victims per population in Israel was relatively small, and this has to do with the professionalism and dedication of the staff in the hospitals. I don't want to tell you human stories, but there are unbelievable human stories from Shaarei Tzedek of physicians and nurses, some of them with large families, Jews, Arabs, Christians, who did not leave the COVID-19 department since March, working there 12 hours in, 12 hours out, some of them sleeping in the hospital. This is one reason. The other reason that I believe is more dominant is the community, the way community medicine is conducted in Israel. So as remnants of our socialized medicine, we have in Israel national health insurance law. I see in the audience my friend Marcus Margolis, another very generous donor to Shaarei Tzedek. So you know Marcus, and the British among you know that the NHS, actually the Israeli National Health System, is very similar to the British NHS, and it doesn't work so well in Britain. And I want to explain. According to the National Health Insurance Law in Israel, enacted in 1995, every citizen of Israel, mandatory, has to be affiliated, has to be insured by one of the four Kupot Cholim, the four medical insurers, the American equivalent of a major HMO. And each one of these citizens has a family physician whom he knows and trusts, a family physician who knows him and his family. He is registered in an outpatient clinic where this family physician works. The secretary at this clinic can contact him immediately and ask him to come and be vaccinated. And that explains how logistically we were able to vaccinate within 3 weeks 1 million people in Israel. This is the close contact with the family clinic. It's the same family clinic that is responsible for the fact that tens of thousands of sick with COVID-19 patients never reach the hospital because each one of them got a mean to measure their oxygen saturation level at home and was contacted every day or every other day by a nurse or the family physician himself or herself to ask how he is feeling. And that's how the hospitals were prevented from being overfilled. This morning, with the very severe way that we have 38 patients on respirators, half of them COVID-19 patients, where Shaarei Tzedek owns 128 respirators. So although we are full, we are far from resources being overwhelmed. And this is the situation all over Israel. And these facts explain how we are the only country in the world that were able to vaccinate 12% of its population in the first 3 weeks of the existence of vaccines anywhere in the world. So right now we are in a situation where the third wave competes with the vaccine. It's no secret that we need, with the Pfizer vaccine, first shot, 3 weeks intermission, second shot, and another week to 12 days in order to attain 95% of immunity. 95% of the people will obtain immunity. In Israel, 1 million people, the highest risk group, are now in between the two injections. I hope that with the additional vaccinations, though we have a temporary shortage of vaccines, we will probably vaccinate 1.3, 1.4 million people, and that's the highest risk group. The estimate is that the full high-risk group in Israel counts between 1.8 to 2 million people. Now, what happens a week after 1.5 million people will get the vaccine, all of them from the high-risk group? What will happen is that we will see very quickly a very steep decline in the number of severely sick, because these are the highest group. The case of this, the miserable case of the 40-year-old girl from yesterday, this is the unusual. This is a yotze min haklal, the exception to the rule that attests to the rule, and we will not see many such cases. We know it from past experience. And all the real high-risk group, if they will suffer, it will be a very mild disease. Probably the disease will be completely preventable. So that's where we stand in Israel. I wish that that will be the situation in every country in the world. I believe it will happen in the US, in the UK, but it will take 2 or 3 or maybe 4 more months. And until then, we should all keep social distancing as meticulously as we did so far. Other common questions: should someone who got the first shot from Pfizer get the second shot from Moderna if this is available to him or to her? I would not mix. It's the same technology, but some change in the physical properties. You can see it from the deep freeze that is different between. It's highly recommended not to mix the two vaccines, but if there will be no other choice, some of you got the Moderna or the Pfizer first, and within 3 or 4 or 5 weeks, the other company will be the only one that will be available. I would take it, but try to get the same vaccine. What should be the period that should be allowed? If the dictate of the companies is 3 weeks apart between the 2 shots by Pfizer and 4 weeks apart by Moderna, if the second shot is unavailable, by the way, in Israel, immediately, anybody who got the first shot was already allocated with a date to the second shot, and it's preserved for him. But this is not the situation in all countries. So how long can we wait? We don't know the answer. It was not experimented, so we don't know the answer. Scientific logic says that additional few weeks will not change the situation. That if you get the second shot, not after 3 or 4 weeks from the first shot, but after 6 or 7 weeks, it's probably safe, but it's highly recommendable to get it in the specified time by the companies. Another frequently asked question is, does the vaccine prevent you from being contagious to others? It prevents you from getting the disease. Does it prevent you from being contagious to others? There is no definite question. It is being researched now intensively. Theoretically, someone who is vaccinated and he is in an environment where someone sheds the virus, sneezes near him, and is without a mask, and that's why vaccinees should also wear a mask until further notice. But let's say he or she does not, and the virus accumulated in the mucosa of the nose, we cannot exclude the fact that you cannot be contagious to others. I believe that when the research is completed, we will be cleared from that. But so far, you may be contagious, but you yourself are immune, and that's why it is so important to get the vaccine. The last frequently asked question, and then I will open this presentation to questions. I see in the chats, Uri, I'm sure you follow it, that there are 35 questions. Yes, They are probably overlapping. Please try to work on them and you will read them and try to group them together. So the last frequently asked question is, how long should one wait after he had COVID in order to get the vaccine, or should he at all get the vaccine if he got the COVID-19? So the answer is the following. It is well proven and nothing to worry that the vaccine given to someone who already had COVID-19 is not damaging. There is no harm in getting it. That's a definite answer. The second question is, should we get it? And the answer is the following. Because we don't know how much COVID-19, for how long does it confer immunity, and because the level of antibodies that is elicited by, that is built by the vaccine is much higher than the level of antibodies that is conferred by the disease itself, it's probably recommendable to get the vaccine, even those who got COVID-19. But in the present situation where the vaccine is such a scarce commodity, I would not recommend anybody of you who had the COVID-19, of your relatives or acquaintances, to rush and ask for the vaccine. You don't have to be hysterical. You are immune. You are immune probably for much more than the 4 months that the antibodies last. Probably for a year. I would not exclude even 2 years. So in terms of priority and of really responsibility towards the community, those who already sustained COVID-19 should be the last to get the vaccine, and that's what we are doing in Israel. There is no rush in that, but there is no harm in getting it. That's I try to cover all the topics that I promised you, and I open this presentation to question. Uri, please be the MC for this.
Thank you. Thank you very much. The truth is that the majority of the questions have already been answered. However, there are still questions that were asked, and some of them were even asked a few times. Like there's quite a lot of questions about all the new sources of the virus, to talk about a South African variety, mutations, the British mutation. How do you look upon that, and how safe do you think that the vaccine will be?
So I think I related to that, but many asked, so I will repeat it. I explained, I think at length, the mutations that we know now are different from the original virus by only few amino acids, which is a large segment of this, very small segment of the spike protein. So scientific logic and initial experiments so far show that the present vaccine will be efficacious against the existing mutations. We cannot guarantee that in the future there will be wilder mutations where the present vaccine will not be efficacious for. But right now, there is no place to be concerned.
Now, is the vaccine effective for someone taking immunosuppressant drugs?
Okay, that's a very important question. I meant to relate to it, so I thank you for the question. So the vaccine is definitely safe for the immunosuppressed. Depends, it's safe for any immunosuppressed patient, even patients who yesterday, God forbid, finished a chemotherapy session. The question is, the more, not the question, the statement is, the more your immune system is suppressed, the less chance you have to respond to the vaccine. That's why if someone is on chemotherapy now, I will wait in between chemotherapy sessions that are usually a few weeks, 3 to 6 weeks, and let the bone marrow and the immune system recuperate a little bit and then give the vaccine. But the vaccine is not dangerous for the immunosuppressed, and actually the official recommendation is to give it to immunosuppressed. And those who were not acutely immunosuppressed recently, like those on chemotherapy, but they suffer, they take low dose of steroids because of rheumatological disorders, they are chronically a little bit immunosuppressed or intermediate level of immunosuppression, they should be the first to get the vaccine because they are more prone to the disease, to more severe disease, and they should get the vaccine. and hope that the vaccine will work with the partial activity of their immune system. And experimental data so far shows that that's exactly what happens. So it's not only not contraindicated for an immunosuppressed to get the vaccine, but also it's mandatory to have it. And I'm sure the next question will be about allergies.
Exactly.
Okay, so let me relate to allergies. So again, there is a lot of misinformation, Allergic reaction runs the spectrum from mild rash on the body to a more bothering rash called urticaria, to swelling of the face, sometimes even laborious breathing, difficulties in breathing, and the extreme allergic manifestation is called anaphylactic shock. That's when someone responds to a medication, to certain food like nuts, definitely to vaccine, when he or she have a history of developing anaphylactic shock from a vaccine or a non-vaccine material, like nuts. But I'm talking anaphylactic shock, not a skin rash, not urticaria, not swelling of the face, not difficulties in breathing, but anaphylactic shock. That's really drop of blood pressure and loss of consciousness. Only those cannot get the vaccine. Even the official authorities, including the FDA and the CDC, recommends even to those who had an anaphylactic shock from nutrition or from medications, but not from a vaccine, to be vaccinated, but in a medical environment, and to be looked after for a full hour, and there should be an adrenaline shot in the area, an EpiPen, because that's what we give to every patient who has a history of anaphylactic shock. We give him a pen and a syringe, a very thin syringe called EpiPen. Epi stands for epinephrine, which is another name for adrenaline. If someone, for instance, fainted, developed anaphylactic shock after a sting of a bee, so he usually goes with an EpiPen. If he gets a sting, he just puts it in his leg, and they are taught to do so. So every allergic person should get the vaccine. The only exception is those who responded to other vaccines with an anaphylactic shock. And if he or she belongs to a high-risk group, I would recommend even this patient to get the vaccine, but after consultation with an allergologist and in a very safe environment where it can be injected epinephrine, if God forbids, he develops anaphylactic shock. All the others, allergic diseases, asthma, can get it. Anyway, you have to be observed for 15 minutes. Maybe if you have heavy allergic history, ask to stay around the nurse for 30 minutes. Everywhere where the vaccine is being given, there are resuscitation facilities, and there is nothing to worry. But I'm very worried from the fact that such high percentage of the population suffer from allergies that have nothing to do with anaphylactic shock, and those people are reluctant or hesitant to be vaccinated. It's a mistake that can harm us.
Okay, there's been quite a lot of good publicity for Israel in the world press the last few weeks. However, there's also been some very reports from Israel, some of the really typical anti-Israel, and even some of it very anti-Semitic. And one of the questions that's been asked now a few times is if the vaccine is really available for everybody in Israel, including non-citizens, including the Palestinians, and including the Israeli Arabs.
Okay, so Israel has a population of 9 million people, 9.2. Around 2 million are under the age of 18, and at this stage we do not vaccinate under 18 because they did not participate in the phase 3 trials, although all scientists are sure that it's safe, but these are the easiest group, so they are excluded. We remain with 7 million people. A little bit less than 2 million are considered high risk, above 60, and or with background diseases, they will be vaccinated very early. Needless to say, 2 million are Arabs, Israeli Arabs, with Israeli Taudat Zehut ID. There is no difference between them and Jews. I think it's even unnecessary to mention. Unfortunately, what we see in the vaccination centers is that the Arab population is not hasty to cooperate and to get vaccinated. The same happened with the Haredi ultra-Orthodox community, but about 2 weeks ago, their major leaders came out saying that they should go, so we don't see this problem among the ultra-Orthodox anymore. They flood the vaccination centers. The Arabs do not do so, but needless to say, I mean, for me as an Israeli born and someone who runs a hospital where 25% of the patients are Israeli Arabs and about 25% of the staff, and you should leave, suffice it to say that the two heads of the COVID-19 largest department in Shaarei Tzedek, the physician is Dr. Ramzi Kurd, an Israeli Arab, and the head nurse is a nurse with 7 children who covers her hair, ultra-Orthodox. And this couple work hand in hand for the sake of the patient. So nobody is even considering discriminating against Israeli Arabs. As far as the Palestinian population who are not Israeli citizens, here the rule of scarce commodity is Aniyei Ircha Kodmim, the poor of your city are first, but we are giving advice, we are helping them to get. The rumors are that they got a significant amount of the Russian vaccine and they are giving it, and it's being given all over Russia. We are in no situation to supply Gaza and Judah and Samaria Arabs to supply them with vaccine right now, but we are definitely supporting them in other ways, but Israeli Arabs for sure. As far as non-Israeli citizens, so there was an order for the ministry before we understood that January will probably bring about a certain intermission in the supply, that any foreigner who is in Israel already and is in the risk group above 60 will be entitled to vaccinations. And within this frame and this order, we gave to many of Shaarei Tzedek friends, not necessarily donors. If they are over 60, we declined even major donors who were under 60. I think some of you present in this lecture know for sure that we did this. We are trying to be with a high moral values, but above 60, we gave it. Unfortunately, starting yesterday, the supply to hospitals stopped. I don't know if until the end of January, not the second shots, the second shots are there, so we are unable to do it. But as a rule of thumb, I don't want all of you to fly to Israel for that before finding out, but the regulation of the ministry was that if a tourist is already here, even if he does not have an Israeli passport and Israeli ID, if he or she are above 60, they should get the vaccine, and we at Shaarei Tzedek gave tens of these vaccines to this group of the population.
Okay, so you discussed the vaccine from Pfizer, from Moderna. How is the AstraZeneca different? And if I now have gotten, let's say, the Pfizer vaccines, should I better be safe than sorry and maybe also go for the AstraZeneca, like get a double portion?
Look, as far as I know, AstraZeneca did not get the EUA, the emergency use authorization from the FDA yet. So they got it from the British,
but not it's already
from the UK. They got it from the UK. My recommendation would be to wait for the FDA. The UK is coping with logistic problems, with other problems. Citizens of the UK who are present here will confirm it. They also came out with the idea to give the first shot to a wider segment of the population without worrying about the second shot. Most of my colleagues, the scientists and vaccine experts, are cautioning against it. So I don't want to relate to the approval of AstraZeneca by the UK. If you have a choice, wait for the FDA approval. It's a different technology that proved in the past. By the way, the Israeli vaccine, which probably will not be ready after phase 3 trials before the last quarter of 2021, both of them, the AstraZeneca and the Israeli vaccine, are a different technology that I mentioned at the beginning of the lecture. It's an engineered virus. It's the Israeli vaccine is adenovirus. I don't know which virus is the AstraZeneca, engineered virus that is carrying part of the genome of the COVID virus in order to stimulate the immune system. But they inject into the body an attenuated other or a killed other virus that is carrying a genome. It's not the mRNA technology. I don't think it's less safe, but it still remains to be proven. So if I had been given the choice to get the AstraZeneca, I would take it only after the FDA approval.
Okay, then we have a little tricky question here. You said before that it could give up to a year immunity. If it hasn't been tested for that long, how will we know how long time the immunity will last?
Well, we will see new cases, that's for sure. And also the best laboratories in the world are working in that. Once we will have tens of millions, even the 6 million people who got the vaccine so far, true for yesterday, around the world, they will be followed very, very meticulously by many, many researchers. Many of them will have repeat tests for their antibody level, for their cellular immunity level. And believe me, we will know exactly. There will be articles in the literature within the next few months. How long does the COVID-19 confer real immunity, and how long does the vaccine confer? Also, what is still unknown is the pace and type of mutations that will show up. There will definitely be new mutations. Will all of them will be as close to the original virus as the present mutations? We don't know. But believe me, there is interest to so many virologists. I mean, this is a celebration for people who devoted, scientists who devoted all their life to research viruses and vaccines, and they will supply the answer very soon.
Okay, we unfortunately are out of time. I would like to thank Professor Halevy so much for this amazing lecture with so many facts. As a matter of fact, there's so many facts that it might be worth listening to it again. So there will be a recording available from tomorrow. We will make sure that you will get the link to the recording. We also like to wish Professor Halevy continued success on the other side of the Atlantic, and look forward to wish him welcome back here as soon as possible here in Israel. The country is not the same without you. So thank you so much to everybody for listening in. I'm sure that we all learned a lot, and we all look forward to welcome you all here in Israel. That's right, Tedek, in good health. And may those of you who haven't gotten the vaccine yet or can't get it yet, hopefully you will get it soon. And Bemet, toda rabba. Thank you for joining us tonight. Erev Tov, good evening here from Yerushalayim, and have a continued good day all over. Thank you very much.
Thank you very much, Uri, and thank you for your attention. Keep safe.